Hi, I'm Peyton Keyser. I am the Chief Informatics Officer, and I'm going to be discussing emergency response and educational tools. All right, what kind of impact does our emergency response have on our patient outcomes? Our patient wait times in the ER directly impact outcomes and experiences. It's important to improve these times to be efficient and focus on triaging patients correctly to improve patient safety. We can use technology to better educate our nurses on triaging patients correctly, and it's going to impact these patient outcomes directly. We want to improve door to care time, improve our patient experience, and be safe and correct with triaging. Our patient surveys have reported that there has been a 30% increase in dissatisfaction of patient door to care times, and our data shows average door to care times have increased by 15% in the last 6 months. So our learning objectives, we want to improve our door to care time for patient walk-ins in the ED by 20% in the next 6 months. We can monitor this through the EHR and timestamps. And we also are going to train 100% of our emergency room staff with AI simulations and prioritization tools in 1 month of implementation, which we will measure through learning management systems. Making sure to achieve faster triage times will help with time-sensitive health situations and patient outcomes. These objectives are achievable and relevant to improving our patient outcomes. We want to advance our learning, our staff's learning, and we will be establishing a monthly in-service with clinical emergency staff to discuss additional our educational technology and tools that will be implemented. We're going to allow for discussion between our staff and discuss door to care times and where we have room for improvement. We're going to allot 1 hour monthly of dedicated educational learning for our emergency response clinical staff. This time will be used to announce our new educational tools and our 1 hour a month new rule. We have our new tools for learning, our virtual patient simulations via iSimulate. We're going to implement virtual patient simulations that will give staff triage scenarios so they can improve their knowledge and evaluate how they are progressing. We're going to have e-learning modules via Course RA, and these modules will have information regarding triaging knowledge and going into depth about situations in the emergency setting. We're also going to have monthly discussion forums via Microsoft Teams to share ideas amongst each other and ask questions regarding content. Our resources for success include clinical technology that we already have, such as the EHR and our learning management systems. Our support team that includes nursing educators, ER leadership, and IT and our IT and informatics team. This staff will help to encourage our emergency clinical staff to advance their education and their understanding. We also need to allocate a budget for our staff time and the simulation equipment and learning software needed. The timeline of our implementation is going to start in 1 month. We're going to have the all staff in service and learning programs. And then in the 2 months, we are going to evaluate the learning programs and how they are being completed by our staff. In 3 months, we're going to look and analyze data from door to care times. And in 4 months, we're going to make sure 100% of our monthly learning programs are completed by our staff. In 5 months, we're going to receive staff feedback, and in 6 months, we're going to discuss door to care times and see how they decrease, and hopefully they will be decreased by 20%. Our recruiting plan is going to include our triage nurses, ED physicians, and registration clerks in the in-service. We're going to present our plan and create our team. We're going to present learning objectives and educational tools that will be implemented for the following months, and we're going to enlist educational teams to teach staff of the new technologies provided. Potential challenges that we may run into are low attendance for our monthly staff in service and non-compliance with our online simulations. We're going to make sure attendance is mandatory, and we're going to allow staff to make up by having online attendance. We're also going to offer continuing credits and a database for staff to complete their virtual reminders, and a database that reminds our staff to finish their continuation of learning. Okay, so we are going to evaluate our implementations with analysts that are going to look at our EHR to identify our trends to our door-to-care time. And we're going to provide surveys for both staff and patient satisfaction. Thank you for listening. Any questions at all? Thank you.